Hello, my name is Nicole Green, and this is my case study presentation 1 for SPCE 638. The client discussed in this case study is a 5-year-old African-American male. He lives in a single mother household and attends ABA therapy 5 days a week for 30 hours a week. He also attends speech therapy, occupational therapy, and physical therapy. This client is delayed in speech and struggles with communication, social, and adaptive skills. He resorts to maladaptive behavior, such as screaming and property disruption, when wanting the attention from others or wanting to escape a task. The behavior of concern is property disruption. The operational definition for property disruption is any instance the client pushes tasks off the table, crumbles items, throws items, or attempts to throw them. An example would be when the client is playing with a toy and throws it across the room. A non-example would be if the client is cleaning up and tosses a toy into the bin. What reinforces property disruption in the client? We're going to be going over task list B4, define and provide examples of positive and negative reinforcement contingencies, as well as task list B6, define and provide examples of positive and negative punishment contingencies. Through the assessments of the client's initial functional analysis during his intake, it was deducted that property disruption is maintained through the dual functions of attention and escape. Observation in a functional assessment interview with the parent was also used to make this finding. Property disruption is maintained through negative attention by various family members, examples being stop doing that, as well as allowing the client to escape the task due to the family not wanting to deal with escalated behaviors, such as resulting in a tantrum, which also includes the targeted behavior of property disruption. The interventions implemented. So we're going to be going over task list B12, which define and provide examples of motivating operations, as well as task list B5, define and provide examples of schedules of reinforcement. So the interventions being implemented are divided attention, as well as a man for break / man for all done. For the divided attention program, our focus is to work on the client not having the full attention from the therapist and engaging in appropriate behaviors during the time interval. Examples being playing with toys or playing with peer. This program is on a fixed time interval of reinforcement of every 3 minutes. The client is not engaging in the targeted behavior. The client's motivating operation is attention from the therapist. So as the 3 minutes go on, the motivation for attention gets higher. Once the time interval is up and the client did not engage in property disruption, the client gains reinforcement through verbal praise, playtime with the therapist, tickles, etc. Since the targeted behavior has a dual function, we also needed to target the behavior when it is escaped maintained. Teaching the client how to man all done or for a break during aversive tasks teaches him an important behavior replacement skill, as the client is motivated to escape the task. This is in the hopes that clients' property disruption decreases while their communication skills increase. Continuous reinforcement is currently being implemented in order to increase the desired response. Generalization and maintenance of treatment. So we're going to be going over task list B11, define and provide examples of discrimination, generalization, and maintenance. Generalization for these interventions are still ongoing. Parent trainings are conducted to promote generalization across the client's environment as well as with other people. We have taught planned ignoring with the client's caregiver, as well as created a similar parent goal of divided attention where the caregiver provides reinforcement to the client for not engaging in the targeted behavior while the caregiver was busy. The client also has 2 therapists who switch out every other day in order to promote generalization in the clinic. The outcome of the interventions are still ongoing. We have seen progress in his MANS as well as the divided attention program. Once the client demonstrates the short-term objective of undivided attention for up to 3 minutes, then the time interval will increase to 5 minutes. Obstacles for the client's MANS all done / man for break programs included the client's delay in speech. Prompt dependency was also seen in the beginning of the intervention. For the client's divided attention program, a form of extinction burst of the targeted behavior occurred the first few sessions the intervention was being implemented. The client's MANS all done and MAN for break programs needed to be modified to include verbal prompts, then changed to fade out the verbal prompts. Modifications were not used for the divided attention program. Thank you.